Usually, when we think about taking a pill, we bring this expectation of like mechanical precision to it, you know?
Absolutely, like a targeted laser.
Right. You have a headache, you swallow an ibuprofen, and you just expect the pain to quietly fade away. The medicine goes in, finds the specific problem, fixes it, and leaves the rest of your body completely undisturbed.
Yeah, that mental model works well enough for everyday stuff.
Yeah.
But the moment you step into the world of reproductive pharmacology, I mean, that illusion of surgical precision just completely vanishes.
Which brings us to the core of today's deep dive. If you're the kind of learner who wants to understand the hidden, often really messy microscopic mechanisms happening inside your own body, this is absolutely for you.
Definitely.
We are looking at a highly specific question today that a lot of people have wondered about or maybe even experienced firsthand, but you almost never hear it discussed openly.
Right, it's kind of a taboo or just overlooked.
Exactly. So we are answering this. Does the use of oral progesterone-only emergency contraception, so like Plan B, cause a sharp temporary drop in cervical mucus production and daily vaginal lubrication?
And, it's a question that really forces us to look past the primary marketing of these medications.
Right.
Because, I mean, most people understand the overarching goal, right?
Mhm.
Emergency contraception is there to prevent an unintended pregnancy. But very few people understand the immediate cascading biological events it triggers across the entire vaginal ecosystem to actually pull that off.
It's a massive chain reaction.
It really is.
Yeah.
So today, by synthesizing medical guidelines, pharmacokinetic data, and real-world patient reviews, we're going to unpack the mechanics of how a massive one-time dose of synthetic hormones fundamentally alters your daily lubrication, the actual physical architecture of your cervical mucus, and even your baseline vaginal pH.
Okay, so to understand if a pill causes a sudden drop in lubrication, we first need to map out what this medication is actually chemically engineered to do, right? Like from the moment it enters the system.
Right, exactly. So the active ingredient we're looking at is levonorgestrel, which you'll see abbreviated as LNG in the medical text.
LNG, okay.
Yeah, and it's a synthetic progestin. Now, its main directive is systemic, meaning it operates on a really wide scale. It travels through the bloodstream to basically intercept the communication between your brain and your ovaries.
So it's blocking the signal.
Precisely. It works to delay or completely blunt what's known as the luteinizing hormone surge, or the LH surge.
And just for context, the LH surge is essentially the chemical starting gun, right? It tells the ovary, hey, it's time to release a mature egg.
Yeah, that's a perfect way to describe it. So by suppressing that specific hormone surge, levonorgestrel stops ovulation from happening at all. And if no egg is released, well, there's nothing for the sperm to fertilize.
Right, mission accomplished.
Right. But, and this is the key, the systemic effect on the brain and ovaries is only one part of the story. Because this synthetic progestin also triggers an intense, really localized secondary effect further down the reproductive tract.
Specifically at the cervix.
Exactly.
Which brings us to the daily reality of cervical mucus. If you look at the guidelines for fertility awareness methods, there's a very distinct baseline for what's supposed to happen in the days leading up to ovulation.
Your body's naturally ramping up estrogen production.
Right, and as that estrogen rises, it totally changes the water content and the molecular structure of your cervical secretions. The mucus becomes highly alkaline, slippery, wet, and like incredibly stretchy.
The clinical texts actually describe it as looking and feeling like raw egg white.
Oh, wow, yeah.
Yeah, and that specific texture and pH are biologically engineered to keep sperm alive and help them swim upward as efficiently as possible.
So normally your body is essentially building a biological slip and slide for sperm.
I love that analogy, yes.
But when you introduce levonorgestrel into the system, you are instantly replacing that slip and slide with a tar pit.
A tar pit, that is, yeah, that's a highly accurate way to visualize it. What's fascinating here is how the medication basically manipulates time within your local tissues.
Wait, what do you mean manipulates time?
Well, under normal circumstances, after an egg is released, you get this temporary gland on the ovary called the corpus luteum, and it starts pumping out progesterone.
Okay.
And that natural progesterone is what thickens the cervical mucus, basically closing the window of fertility. So by introducing a massive spike of synthetic progestin via the pill, you are tricking the cervical tissue into believing ovulation has already happened.
Oh, wow. Even if it hasn't.
Exactly.
Yeah.
The tissue reacts instantly, and it alters the physical architecture of the mucus. It mutates from that slippery, stretchy fluid into this dense, sticky, and completely hostile barrier.
So if you are the person taking the pill, you might wake up the next morning and notice a really sudden, stark lack of natural wetness. It feels like your daily lubrication just plummeted.
Right.
But based on the mechanics you're describing, what's happening initially isn't necessarily a drop in the actual volume of fluid being produced, right?
That's right.
It's this radical localized change in the texture of the fluid. The mucus is still there, it's just been structurally reconfigured to trap sperm in a physical barricade.
Yeah, it acts as a localized net. The fluid becomes so thick and cross-linked that sperm simply cannot penetrate the cervico-uterine canal.
Okay, but if the estrogen drop and the progestin spike are physically thickening the mucus at the cervix, what is that same hormonal shift doing to the walls of the vagina itself?
That's the next big piece of the puzzle.
Because a change in mucus texture is one thing, but actual physiological vaginal dryness, like a true lack of tissue moisture, that's a different issue, right?
It is. And to answer that, we have to look at the broader hormonal cascade triggered by the pill. And we actually have real-world data showing how this manifests.
Yeah, in our sources, we looked at data from the Lowdown, which is this really cool UK-based community review platform where patients log their specific side effects for various contraceptives.
It's a great resource.
It really is. And out of a sample of 34 specific user reviews for the morning after pill, 12% of the reviewers explicitly documented vaginal dryness as a prominent side effect.
Right, which demonstrates that for a significant minority of patients, this is not just a perceived change in mucus texture. It's a true physiological event.
So what's actually causing the physical dryness then?
Well, the mechanism driving this deep tissue dryness is tied to how a massive influx of synthetic progestin impacts two other crucial hormones, estrogen and testosterone.
Estrogen and testosterone, okay.
Yeah, in the female body, estrogen is primarily responsible for maintaining the thickness, elasticity, and the overall hydration of the vaginal walls.
Right. And I think a lot of people listening hear testosterone and immediately associate it exclusively with male biology, muscle growth, things like that.
Oh, for sure. It's a common misconception.
So how does a drop in testosterone factor into female vaginal dryness?
Well, testosterone plays a really fundamental role in the female reproductive system, particularly when it comes to sexual health. It's heavily involved in supporting sexual arousal, driving blood flow to the genital tissues, and this is key, stimulating the glands that produce natural lubrication.
Oh, interesting.
Yeah, so when the levels of both estrogen and free testosterone drop, the vaginal tissues literally lose their primary sources of hydration and physical engorgement.
Okay, let's unpack this for a second because I can totally understand how taking a daily birth control pill over the course of, say, 2 years could eventually cause chronic dryness.
With a cumulative effect.
Exactly. The daily pills slowly suppress your natural hormone production over time, steadily lowering your estrogen and testosterone baselines. But we are talking about a single emergency pill here. How does one pill trigger that kind of deep tissue desert effect so quickly?
To answer that, we really have to look at the pharmacokinetics of levonorgestrel specifically, the sheer scale and speed of the dose.
Okay.
So a standard daily birth control pill might contain something like 0.1 milligrams of levonorgestrel. The emergency contraceptive pill contains 1.5 milligrams.
Wow. So you were dropping 15 times the normal daily dose into your stomach all at once.
Exactly. And it is incredibly resilient. It boasts an 85 to 100% bioavailability.
Meaning what exactly?
Meaning almost none of it is destroyed by stomach acid or intestinal enzymes. It passes almost completely into the bloodstream.
That is a staggering amount of hormones hitting the system simultaneously.
It is. And the speed is just as critical. It reaches its peak plasma concentration, so the highest level of the drug in your blood, in just 1.6 hours.
Wait, really? Just 1.6 hours?
Yeah. To put that in perspective, normal food digestion takes hours just to leave the stomach. This synthetic hormone completely saturates your bloodstream in under 100 minutes.
That's incredibly fast.
Right. It operates less like a targeted medication and more like pulling the fire alarm in an office building. The massive sudden influx forces the entire system to just stop what it's doing and react.
So what does that systemic reaction look like on a chemical level?
Well, one of the immediate reactions occurs in the liver. When the liver detects this massive spike in hormones, it suddenly ramps up the production of a protein called sex hormone-binding globulin, or SHBG.
SHBG. Okay, so the liver starts pumping out this protein. What is the SHBG actually doing to cause the dryness?
SHBG essentially acts as a biological sponge in your bloodstream. Its entire job is to bind to sex hormones.
Okay.
But once a hormone like estrogen or testosterone is bound to SHBG, it becomes inactive. It can no longer be absorbed or utilized by your body's tissues.
Oh, I see.
So the emergency pill forces your liver to flood the bloodstream with these sponges, which quickly soak up the active estrogen and testosterone your vaginal tissues rely on to stay plump, hydrated, and lubricated.
And the end result is that sudden, noticeable, and very real feeling of dryness.
Precisely. The body is desperately trying to regulate a sudden chemical flash flood, and the vaginal tissues basically get caught in the crossfire.
Here's where it gets really interesting, though. What if that uncomfortable, dry, irritated feeling following the pill isn't just a lack of moisture?
Oh, this is a crucial point.
Right. What if the drop in estrogen is actively collapsing the entire microbial ecosystem?
Yeah, this introduces a fascinating and often really misunderstood consequence of emergency contraception, the disruption of the vaginal microbiome and its pH balance.
We have a highly illuminating Q&A from the VinMec Health blog in our sources. A patient actually reached out to the medical staff because 4 days after taking emergency contraception, she started experiencing a milky white discharge with a noticeable, unpleasant odor.
Right.
And the doctors explained that this high-dose hormone intervention doesn't just alter mucus and bind up hormones, it actually shifts the baseline pH of the vagina.
Yeah, and to understand why that happens, we have to look at the day-to-day life cycle of the vaginal microbiome. A healthy vaginal environment is naturally acidic.
Right, and that acidity acts as a shield against infections.
Exactly. And the primary guardians of this acidic environment are good bacteria called lactobacilli.
So how does the pill disrupt those good bacteria?
Well, it comes back to the estrogen drop we discussed a minute ago. Estrogen actually acts as the food supplier for the microbiome.
Oh, really?
Yeah, it stimulates the cells lining the vaginal walls to produce a type of complex sugar called glycogen. The lactobacilli feed on this glycogen, and as they digest it, they produce lactic acid. And that lactic acid is what keeps the vaginal pH comfortably low, creating an environment where harmful pathogens just cannot survive.
Wow, it's an entirely self-sustaining microeconomy. Estrogen provides the sugar, the good bacteria eat the sugar, and their byproduct is the acid that protects the whole neighborhood.
Exactly. So when that 1.5 milligram dose of levonorgestrel hits the bloodstream and crushes the estrogen baseline, it cuts off the food supply. The vaginal cells stop producing glycogen.
And without their primary food source, the population of lactobacilli drops rapidly.
Right. And as the good bacteria starve, the production of lactic acid stops, causing the vaginal pH to rise. The environment becomes significantly less acidic.
And when the neighborhood becomes less acidic, the protective shield drops, which allows opportunistic bacteria and fungi that were, already present in small numbers to suddenly multiply out of control.
Yes, and this is the exact mechanism that leads to conditions like bacterial vaginosis, or BV, as well as vaginal candidiasis, which is commonly known as a yeast infection.
Which brings us back to the dryness symptom.
Yes. The source material from FPA Women's Health highlights a critical detail regarding these newly foreign infections. Their primary symptoms are inflammation, severe itching, and an intense feeling of dryness.
Which creates a really confusing paradox for the person experiencing it, right?
Absolutely.
You take the morning after pill, and a few days later, your tissues feel scratchy, inflamed, and incredibly dry. Your immediate assumption is that the pill simply dehydrated you.
Which makes sense logically.
Right, but you could actually be experiencing a sudden increase in abnormal moisture, like that milky white discharge described by the VinMec patient, because the pill disrupted your pH and triggered a bacterial overgrowth. You feel dry, but the clinical reality is an infection.
It perfectly highlights why symptom interpretation can be so incredibly deceptive. The feeling of dryness is actually a symptom of inflammation caused by the yeast or bacteria.
That is wild.
Yeah, and medical professionals strongly advise that if you experience significant changes in vaginal secretions, odor, or persistent irritation after taking emergency contraception, it is really worth consulting a doctor.
Because you need to determine whether you are dealing with temporary hormonal dehydration from that SHBG spike or a newly opportunistic infection caused by the pH shift.
Exactly. You need to know what you're actually treating.
Okay. So we've tracked the effects of this pill from the cervix, where it turns the mucus into a sticky net down to the vaginal walls, where it binds up hormones and shifts the microbiome.
I have.
But we still have to explore the final frontier of the reproductive tract, the uterus.
Oh boy. Here we go.
Right. Does this massive hormone dose alter the uterine lining, the endometrium, to prevent a fertilized egg from implanting?
We are now stepping into what is arguably the most debated, heavily scrutinized, and consequential aspect of emergency contraception in modern pharmacology.
And I want to be incredibly clear with you right now because this is such a highly debated topic. And our goal today is just to look at what the medical texts actually say. We are absolutely not taking a side here. We are not endorsing a specific viewpoint.
Right, we're strictly analyzing the conflicting literature.
Exactly. We are just reporting what the sources provide. And it's fascinating to see how divided the highest authorities are on this specific mechanism.
It really is. The core of the debate centers on whether the pill acts strictly as a pre-fertilization contraceptive or if it has a post-fertilization effect on the uterus itself.
So let's lay out the first perspective. On one side of the medical literature, you have the official FDA labeling for Plan B, alongside information from reproductive health organizations like Compass Care.
Right.
Their documentation states that the pill has a third mechanism of action. They indicate that beyond stopping ovulation and thickening the cervical mucus, levonorgestrel alters the lining of the uterus, decreasing the probability of implantation.
And the biological implication of that FDA-supported perspective is significant. It suggests that if the medication fails to stop ovulation and a sperm successfully fertilizes an egg, the resulting embryo would travel down the fallopian tube only to find an altered, inhospitable uterine lining.
And unable to attach to the endometrium, the fertilized egg would be destroyed.
Exactly. That is the perspective indicating an effect on implantation.
But then on the other hand, we have the second perspective. Literature from organizations like the International Federation of Gynecology and Obstetrics, known as FIGO, along with the World Health Organization and the European Medicines Agency.
Some major heavy hitters.
Right. And they explicitly state the complete opposite. Their official stance is that levonorgestrel does not prevent implantation and has absolutely no effect on an established pregnancy.
Yeah, and to support this position, these global organizations point to advanced in vitro studies, specifically referencing the work of researchers like Lilith Kumar and colleagues.
Okay, what did they do?
Well, to test the implantation theory, these researchers utilized a three-dimensional human endometrial cell culture model.
Wait, hold on. A 3D human endometrial cell culture. Are they essentially building a functioning mini uterus in a petri dish to test this?
That is a very, very close approximation, actually. They culture human endometrial cells in a lab to mimic the biological environment of the uterine wall. Yeah, and in the study, they introduced levonorgestrel to this environment, and then it introduced human blastocysts, which are fertilized eggs in their early developmental stage.
And what happened?
They observed that the presence of the massive levonorgestrel dose did not inhibit the blastocysts from successfully attaching to the endometrial cells.
Interesting.
Yeah, and relying on data like this, FIGO has actively pushed for regulatory bodies to remove any language about implantation from product labeling, maintaining that the pill is exclusively a pre-fertilization contraceptive.
So what does this all mean? As someone just trying to understand the basic mechanics of their own biology, it is staggering to realize that you can have the highest global health authorities and national regulatory agencies looking at the exact same pharmacological event, a massive influx of levonorgestrel, and arriving at fundamentally contradictory conclusions about what it does to the human uterus.
If we connect this to the bigger picture, it perfectly illustrates the immense complexity of modern medical science. We are not analyzing a simple mechanical lever here. The female reproductive system is a deeply interdependent, highly sensitive chemical network.
Right.
When you introduce a systemic disruptor of this magnitude, tracking its microscopic ripple effects across different tissues, over different time frames and different bodies, well, it leaves room for vastly different clinical interpretations of the data.
Which brings us full circle back to the question that launched this whole deep dive. Does the use of oral progesterone-only emergency contraception cause a sharp temporary drop in cervical mucus production and daily lubrication?
The clinical data points to a resounding, multi-layered yes.
It radically alters the physical architecture of the mucus at the cervix, mutating the stretchy, fertile fluid into a dense, sticky barrier.
It triggers a rapid hormonal cascade, forcing the liver to pump out binding proteins that soak up active testosterone and estrogen, literally pulling the hydration directly out of the vaginal tissues and causing true physiological dryness in roughly 12% of users.
And it crashes the estrogen baseline, starving the good bacteria in the vaginal microbiome and causing the pH to rise, which can trigger opportunistic bacterial and yeast infections that perfectly mimic the sensation of intense dryness.
It is a remarkable, chaotic, and frankly, highly effective pharmacological event that touches every part of the vaginal ecosystem.
It really leaves us with a lingering thought about the realities of human biology. We spend the vast majority of our lives completely unaware of the microscopic chemical symphony happening inside us. We only notice it when something drastically shifts.
Absolutely. And, makes you wonder if a single 1.5 milligram dose of synthetic hormones can completely rewrite your vaginal microbiome, alter your mucosal architecture, and dramatically shift your hormonal baseline in just a matter of hours.
Yeah.
What does that reveal about the delicate microscopic chemical conversations happening inside our bodies every single second, entirely without our permission?
That is a wild thought to end on. Thank you for joining us on this deep dive. Keep asking questions, keep looking beneath the surface, and we'll catch you on the next one.